Good afternoon. Today we'll be looking at the visual outcomes of topo-guided laser refractive correction. As we all know, conventional techniques of laser vision correction such as LASIK and PRK have been known to induce or aggravate higher order aberrations leading to photic phenomena such as glare and halos, leading to patient dissatisfaction. Now, with the advent of newer ablation profiles such as wavefront optimized, wavefront guided, and topo guided laser refractive correction, these aim to reduce the induction of corneal aberrations by attempting to create an ideal corneal curvature. The paucity of data on visual outcomes post topo guided PRK prompted us to do this study. We aimed to assess the short-term visual outcomes in terms of visual acuity, contrast sensitivity, and higher order aberrations, as well as assessing the effect of above on quality of life. This was a prospective study conducted over a period of 15 to 18 months, and we included patients with myopic astigmatism aged between 18 to 35 years who also were eligible to undergo topo-guided PRK based on the Allegro Topolizer Vario criteria. All the patients underwent a refractive workup, and the visual acuity, contrast sensitivity, aberrations, as well as quality of life was assessed both pre-operatively and at the 3rd month post-operative visit. We included a total of 88 eyes of 47 patients, of which 51.1% of eyes belong to the 21 to 25 year age group and 56.8% belong to females. Post-operatively, the visual acuity was noted to have a slight decrease, which was although insignificant, could be attributed to the subepithelial haze which was observed in 4 eyes. Contrast sensitivity, both uniocular and binocular, was noted to have a significant improvement post-op. All the corneal aberrations was noted to have a significant increase post-operatively, except for trefoil, which had a significant decrease. Patients also had a significant improvement in terms of daily activities such as swimming, playing sports, driving, photic phenomenon, and vision without glasses. The visual acuity in our study was in good agreement with other studies, where we found that 95.5% of eyes achieved a post-operative vision of 0 logMAR units. Contrast sensitivity, though controversial in other studies, we have noted a significant improvement both monocularly and binocularly. Similarly, aberrations is also controversial in other studies, but we have observed a significant increase in all aberrations post-operatively, except for trefoil, which had a significant decrease. And this decrease of trefoil was found to be a novel finding. It has not been reported in other studies. Quality of life also had a significant improvement, with subjects giving a mean score of 8.4 out of 10 for vision without glasses post-operatively, and this is also in good agreement. Now, at the end of a study, we had this question as to why contrast sensitivity improved despite an increase in aberrations. We could narrow it down to 4 possible explanations. Firstly, the role of epithelium, where epithelium has been noted to increase considerably, thickness has increased considerably post-operatively, where that could contribute to an increase in the spherical aberrations. However, on the flip side, healthy epithelium has also been known to compensate for higher order aberrations, which might have led to the incomplete treatment of aberrations post-operatively. Second reason could be that the enlarged retinal image because of disuse of myopic glasses could also be contributing. Third reason was that there's a complex interaction with the ocular structures, where the positively aberrated cornea could have been negated by the negatively aberrated crystalline lens. Lastly, the cerebral processing mechanisms could not be assessed as to how a person perceives the image. We had certain limitations, mainly the epithelial mapping was not included as an independent parameter. We have taken only corneal aberrations instead of the ocular aberrations as a whole. Ours was a single arm study and we had a small sample size. To conclude, topo-guided PRK is an effective procedure with significant improvement in visual acuity, contrast sensitivity, and patients also reported feeling more satisfied, happy, and confident with their vision. Thank you.
What was the, how did you decide whether topo-guided PRK will be done or
So based on the US FDA protocol, so there are 3 criteria. We check the patient's manifest refraction and the refraction given by the topolizer vario. So if the cylinder in both the patient's refraction as well as the machine which has given, if it's less than 1.25 diopter, so that is a compulsory criteria which has to be met by all patients. Then we have two other criteria depending on their refraction cylinder. If it is more than 2 diopters, then the difference in the axis between the refraction axis as well as the machine axis should be less than 5 degrees. Whereas if it's less than 2 diopter, it should be less than 10 degrees.
Yeah.
So that was the
So
criteria.
have you
for-
compared it with the wavefront optimized, because it is as good as Topoguided in
Ma'am,
in the same
actually,
machine? I mean,
yes, ma'am. We have not
what-
compared per se because we wanted, there was no data on how Topoguided PRK was as such. So ideally, we should have compared with the wavefront optimized, but we wanted to see how just Topoguided PRK would be pre-op and post-op.
And any specific criteria for choosing the patients for PRK and not femtolasic? I mean, were they thinner corneas
No, ma'am,
or
nothing
just
like
random?
that. Yeah.
And any refractive error category you have chosen?
Myopic
from
astigmatism, ma'am. So we have
Myopic.
taken maximum up to -6 myopia and -3 diopter cylinder.
Did you look at the patient's profile? That is, their things like night driving, their
Yes,
profession,
sir.
which
Yes, sir.
requires.
Yes.
But that's not mentioned in your slides.
In the questionnaire, I think I have
No,
mentioned.
questionnaire
right?
is
Yes,
fine.
sir.
But did
But,
you make a comparative? I mean, was that a criteria to choose despite having? Okay, whatever criteria you have for doing the topo guided is fine. But did you also additionally look at it, or you just randomly went just with the technical criteria?
Just with the technical criteria, sir, we've not assessed it.
Okay,
Thank
thank
you.
you.